Alright, I'm going to be doing my IV cert validation. I'm Nicole Schuler, obviously. The first thing I'm going to do is apply a tourniquet. That way it applies more pressure and I can see where the veins are easiest to stick. I'm going to make sure it's not too tight because I don't want to hurt my patient. So then I'm just going to palpate here and see which veins would be the easiest. And it looks like this one might be. So what I'm going to do is put on some clean gloves and untie my tourniquet because I don't want to keep all that pressure on there. So I'm going to remember the spot that I had picked out and I'm going to floor prep. I've also applied a blue Chex underneath the hand because I don't want any blood that may be spilling or anything to get on my patient's bed because I'll most likely be laying in bed. I will wait for my ChloraPrep to dry. So while I'm doing that, I will reapply my tourniquet. Oops. Making sure it's still as tight as I need it to be. And I'm going to open up some of my tools I'll be using here. And also I will be priming my extension tubing so that it's ready for when I need it. Perfect. So then I'm going to ChloraPrep my finger here so I can just palpate to see if that's the vein I still want to use. Take the lid off my cannula here, bevel up. And if I have blood return, which I won't in this hand, I will continue to advance my cannula and pull back my needle. So I'm going to make sure that's stabilized. I'm going to apply some tape just to make sure it stays where it needs to. Making sure not to get any tape on the actual cannula itself. So I'll make sure that's staying where it needs to. I'll open up my 2x2. Maybe, if I can get it open. Then what I'm going to do is I'm going to take my 2x2 and place it under here so that when I remove the cannula and attach my extension tubing, I don't get blood on any of the patient or anything like that. And remove the lid. So then I would aspirate to make sure I'd have blood return and then flush. Just continue the flush here and apply a Tegaderm. At this point I can remove my 2x2. extension here. There's also a piece of paper I would use, and I would label and date it just so that they know how long the IV has been in place. And that is the insertion of an IV, but I'm also going to say I got discontinue orders. So I would get a new 2x2 and also apply new and clean gloves. And take off the tegader. First I'm going to open up my 2x2 just so it's ready for me when I need it, before I remove the rest of the tape here. Also going to get a new tape piece. Doesn't have to be very big, just hold big enough to apply the 2x2. So I'm going to hold my 2x2 over the site where the cannula went in and hold pressure while I discontinue it, making sure that my cannula is still intact. And I will tape my 2x2 there just to hold some pressure so if there's any extra bleeding. And that is everything.